Guys, it's Miss Woodruff and Miss B back again to talk about different topics related to adult med-surg nursing and different skills. As with all videos, I always warn you that your instructor may instruct you to do things a little differently or want a little less detail or more detail. Right now, we're going through focused assessments, and the next assessment we're going to do is a focused assessment on the neurological / head, ears, eyes, nose, and throat. And actually, this video is mostly going to be focused on the head, ears, eyes, nose, and throat. There is going to be a separate one that just focusing on how to do a very in-depth neurological assessment, but you're going to see some parts of that neurological assessment in through this. So we have our lovely patient Cliff over here who's all ready for action to be assessed and everything. So we're going to kind of break this down by each of the different sensory organs we just talked about. So I'm going to start by talking about the eyes. So as with everything that we've brought up before, we always want to start by asking about a history. So obviously we can see Cliff here, he's got his glasses on. So I'd ask about a history of any eye problems, any difficulty, obviously with his vision. I can ask him like, hey, are these reading glasses? Do you wear them all the time? And then I'm going to start my assessment process. And my assessment process for eyes, and I'm going to actually come around here, Ms. B. My assessment process for eyes always starts with inspection. So I'm going to be inspecting here. And what I'm looking for is I'm looking for any external signs of trauma, breakdown, maybe some swelling, maybe a change to the color. Normally the eye color, when I say eye color, I don't mean that like I have brown eyes, but around my eye is white, like what the sclera should be. So I'm looking there to see if that's a different color. I'm looking for any drainage. I'm looking for any abnormality that there may be when it comes to like the size or anything. And when I first am assessing the eyes, especially when I'm looking at the pupils, I want to see what size are they when, there's no light, nothing else going on in them. And so I'm going to just be looking in his eyes and kind of measuring, because that's something I'm going to chart, is how large is his pupil just at rest. So I've kind of looked into the past. I may ask about history of surgical history, like, hey, do you have any history of eye surgery, eye problems, aside from vision, like maybe like glaucoma, cataracts, etc. And then I'm going, after I have done history, I maybe ask about any symptoms, like any itchy, watery quality to their eyes. I might ask about any problems or change recently, like a change to vision. Then I'm going to go and I'm going to use my pen light, which I have right here, to look into their eyes to assess for PERLA. And PERLA stands for, push the screen back a little bit just so it's up more. PERLA stands for Pupils Are Equal and Reactive to Light and Accommodation. Thank you, Ms. B. So when I'm saying the pupils are equal, which means that they should be the same size, and that they're reactive to light, I'm going to shine my flashlight in here on him, and then to accommodation, which I'll talk about accommodation next. So when I'm saying that the pupils are equal, the first step is I would normally turn down the lights. So if I have the lights on, it's going to skew my assessment of how his pupils are reacting, because there's already light in his eyes. So normally I would turn the lights down, which I don't think that I can do that right now, but then what I'm going to do is I'm going to take my pen light, and so I'm going to start from the outside and move in. What I'm looking for is as it enters into his eye and shines on his pupil should go from being larger to smaller. And when it gets smaller, that's when it's telling me a lot of the equal reaction. So then I'm going to go
move his glasses up.
Oh, thank you so much, Miss B. You're right. I do want to move his glasses up. After I do this side, then I'm going to come around and go from the outside in and do the other side. And I'm comparing reaction. Was it fast or was it slow that the pupil changed size? Are their pupils the same size or are they a different size? Don't freak out if they're a different size, because it could just be something from their own history. I've had a lot of people with glass eyes or other things that I thought there was something very, very wrong, but sometimes there may be something to explain. So you always, again, want to ask if it's normal. If you find an abnormality, hey, I noticed this. Has it been this way for a while? Do you know if this was what's normal for you? And so, yeah, so that's what I'm looking for with eyes. Miss B, do you want to tell us about ears and nose?
So sure, with the ears, we're looking at to see if the patient has any drainage, any particles inside, obstructive items. We're looking to see if you let's see, and did I say drainage already?
said-
I
you
think I
said
said drainage. And then
any swelling.
it is swelling, and you also point your paint light into their ears. You do want to raise their top part of their ear up, just so you can at least see some of that outer canal with your pen light. You look one ear, then you go into this the other one. Try to go around the bedside, because if you're like in this side of the bed and you're looking at the other ear or the right ear of the patient, you can't really see it from this angle. Okay,
Mm-hmm.
so go around the bed. You want to ask them about their hearing. Can you hear me okay? Do you wear any hearing aids? Sometimes it's single hearing aids, sometimes it's bilateral. What else can you ask about the ears?
What do you call them? If they've had any trauma to their ears, maybe
surgery?
previous injuries, any hearing loss. Does their hearing change throughout the day? Is there ever a time that's worse? Is there one ear that's better or worse than another? Okay. So yeah, and then you can always test them. Just like the one thing that I forgot to bring up with vision is that you always want to test their vision. Do you have any visual difficulties or visual problems? Then we also want to ask about if they have any hearing problems. Is there anything new or different change to their ability to hear? So yeah.
Okay, so changes in their ability to hear, or any changes recently in their hearing ability. With their nose, we want to, besides asking them, any past surgical history of their operating their nose, or any deviating septum, a surgery, or any fractured nose in the past. After you're done asking them that question, you can ask them, how's your smell right now? Have you noticed any changes in your smell? Do you feel congested? Do you have any sinus allergies, problems? And then you can also look into their nose just with the pen light, shine it up, and then you can see if it's obstructed, or if there's any swelling, bleeding, drainage, etc.
Mm-hmm. Yeah, and anytime you're looking at drainage, you always want to note what the drainage looks like, the consistency, the color, and things like that. Especially here in Texas, you're going to find a lot of people have seasonal allergies, or we like to call them the Texas allergies, around the clock, every day of the year allergies. So it's really common. So knowing kind of what those common signs and symptoms are, and if there's anything that's new or different for this patient compared to what they're normally used to. All right.
I think it's also appropriate to also ask them at that time, if they take any medication. We can additionally ask, do you take any eye drops for your eyes, or any ear drops, or any nasal sprays for allergies or anything like that. You can always inquire about medications as you're assessing.
That's a good point, Miss B, because a lot of times people don't consider that medicine, because sometimes it's just like saline or water, so they don't really consider it medicine. So thanks for bringing that up.
Okay. Yeah. The next is the mouth.
Yeah.
Your turn.
You can switch out. This is a fun little do-si-do. So then the last part of the head, ears, eyes, nose, and throat is going to be the mouth. So in the mouth, of course, I'm first going to start by asking questions. This might go back to some of the stuff we talked about in GI, where I'm going to start kind of first, obviously, I want to ask about any history of dental issues. Are their teeth their own teeth? Have they had to have a lot of dental work done? Do they have any problems in their mouth, any problems swallowing? And keep in mind, remember, the mouth is an opening not only for food, but it's also a part of the respiratory system. So are you coughing? Are you having any difficulty breathing? Do you have a sore throat? Think like upper respiratory symptoms and things like that. So I'm going to ask through some of this history and see what's going on in the past, and then ask about symptoms now. So symptoms that patients might have, they might have a cough, and they might be coughing up sputum. They could have difficulty swallowing. They could have swelling or sores in their mouth. They could have dryness of their mouth. One way to tell about hydration is by looking at how dry or how moist the mucous membranes, or the membranes inside our mouths, are, and that's one way to tell how a patient's doing when it comes to hydration. So anything else you'd add for inspection? Okay. So after I'm doing that inspection, I'm looking, and of course I'm going to use my handy dandy pen light again. I'm looking around. I'm asking them to stick out their tongue and looking underneath their tongue, because sometimes there can be sores or other things, but I'm looking all around their mouth. Oral cancer is becoming more common, so it's always good to be looking for any lesions, things like that. And don't ever think that age is a thing. Like, you know, cancer only happens to older people. A lot of younger people are getting the oral cancer. So it's always good to be looking around, any sores, anything else. I don't need to palpate anything on the mouth or anything like that. If depending on the patient, I may check their gag reflex or something like that, or check their throat, you know, or anything like that. I'm also maybe looking for obstruction to see if there are tonsils in the back of their throat, if they're swollen or enlarged, anything that could affect either their gastrointestinal, like their ability to swallow, or their respiratory system, their ability to breathe. And, you know, kind of see if they're maybe congested, anything like that. Because sometimes people have a nose problem, but it's drifting down into their throat and affecting their throat. So yeah, so there's no auscultation or palpation. That's mostly just inspection and then asking those key questions. Anything you would like to add? All right. So just to kind of summarize, you know, we're talking about the head, ears, eyes, nose, and throat. And we talked about, you know, really asking a lot of the head, ears, eyes, nose, and throat is asking those key questions that are going to be so important for that patient that is, suffering with a problem with this. And a lot of times, maybe this isn't what they're in the hospital for, but it can cause a lot of other discomfort or other issues. So we always want to kind of know, because a lot of this is the sensory stuff. So you may not think about this, but you know, how their vision and hearing is doing has a lot to do with safety, which could affect their recovery and whatever they're recovering from. So I want to make sure that they're safe when it comes to their vision, their hearing. And remember, the ears are also in charge of balance. So we may ask about some of that balance or coordinated movements as we're doing that. If you have any trouble, do you feel lightheaded or dizzy when you get up or change positions, etc. And then after asking questions, we're inspecting, we're looking for any drainage, abnormalities, masses, sores, swelling, etc. Looking for any problems and mostly doing a very thorough inspection. And if this patient was a trauma or otherwise, I may inspect their head. Normally, if you are doing a focus assessment, you're going to obviously inspect the skin very well, all around the scalp, the neck, the face. Just looking for any abnormalities, skin color changes, any masses, anything like that. But keep in mind with most patients, especially if you work places like JPS, you don't want to be sticking your hands in someone's hair unless you know they don't have bugs. But most of the time, you don't have to assess everyone's scalp. It kind of just depends on the patient. But if you do suspect that there's any problems with their scalp or with anything, maybe they had a trauma or something else happening, you may want to look into that. Any last additions? All right. Well, this was your head, ears, eyes, nose, and throat assessment. There is obviously more to come in the other videos. So we look forward to seeing you on that one. I'm going to turn off now.